So I remember having a lot of back pain, which began quite a few years ago when I was abroad doing this DJ gig. And it really came from me twist lifting my record bag continually kind of every weekend whilst wearing high heels and not really taking care of my body and feeling strong enough. But when I was pregnant with my daughter, I had the worst back pain of my life. And I remember thinking it was very strange that I was in so much pain. I came to Circle for an MRI to try and get some answers, really. I remember first being kind of really taken back with how beautiful the hospital was. Kind of when I walked in, it felt like a really amazing hotel or something like that, and really put me at ease. The staff that did the MRI were really, really patient and kind. So I had heard about Dr. McKenna and some of his work, and he had actually treated a few family friends of mine who have had terrible problems with their back over the years. So his reputation was kind of known in Reading, and I thought he's the best person for me to take these results to and discuss my options with. So Dr. McKenna explained to me that I'd slipped my disc. I explained to him the pressures that I had with my work and obviously the baby, and that she needed me and I needed to be able to care for her correctly. So we looked at booking me in for my microdiscectomy surgery as soon as possible. Stuart Wiley is my physiotherapist, and he's also my Pilates teacher here at Circle Reading. And I met him for the first time 2 weeks after my microdiscectomy surgery. And I think I've seen him pretty much every fortnight for the last 6 months.
Part of the rehabilitation process that I really think is important is getting to know my patient. So when I first saw Neev 2 weeks after her spinal surgery, when she came in worried, not knowing how she's going to recover, not knowing how she's going to get back to her job, not knowing how she's going to pick up her baby again, the really important thing for me was understanding who she was as a person, what she wanted to achieve as a person, what were her personal life goals, and how I could help with the rehabilitation of that. A lot of our goals in terms of physiotherapy were about getting her moving again, getting her core muscles working, but also getting her spine moving. At different stages we brought in new exercises, different things that she could do, including things like squats with weights when she was able to. As time has gone on and we've progressed things, Neev, we started to work with an exercise technique called Pilates, or clinical Pilates as physiotherapists will teach, whereby we teach people not just how to use their core muscles, but how to use all the muscles in their body well, how their posture is, how they might move, how they might walk, how they might squat, how they might stretch.
It's really amazing to just be able to be pain-free and also be getting stronger. So I'm hoping that I'll do this next block of Pilates classes, that's the next level up, and keep meeting with Stuart and learning ways to strengthen my core, so that I can prevent having problems with my back in the future.
I get a great deal of satisfaction from seeing a patient do better, from seeing their life improve from a point of lots of pain and unable to do daily things, carrying things, lifting things, to being able to do those as part of the daily life, but also do it with a smile on their face, to see that they're much happier in their life, to see they're in no pain. Gives me an enormous amount of satisfaction, and it's why I do my job. It's why I trained as a physiotherapist, was to help people rehabilitate, get better.